Hello, everyone. This is Deanna Minnick, and welcome to the Detox Summit. Today, we have the pleasure of having Dr. Kara Fitzgerald. And for those of you who aren't familiar with Dr. Fitzgerald, she has a long list of different accomplishments. She received her doctorate of naturopathic medicine from the National College of Natural Medicine in Portland, Oregon. And she completed the first CNME accredited postdoctorate position in nutritional biochemistry and laboratory science at Metametrics Clinical Laboratory under the direction of Richard Lord. So she has quite an extensive laboratory assessment background, and I really do consider her to be the whiz of labs, of functional medicine lab and biomarker analysis. So she's done a lot of different things, and she's written a book together with Dr. Braley on case studies in integrative and functional medicine. And she's a clinician, she's a writer, she's a presenter. She's been all over the world in India, Hong Kong, South Africa. And currently, she's on the faculty at the Institute for Functional Medicine and has a private practice in Sandy Hook, Connecticut. So welcome, Kara.
Thanks for having me, Deanna. This is really exciting and a interesting, timely, and important topic.
Well, indeed. And you were one of the first people I thought of when we were putting together this summit, because so many times people are confused about how do they even know that they're toxic. And I know that this is going to be an area that we're going to mine very deeply within this call. But before we go there, I'm just wondering if you can just give us a general snapshot of you, your personal history. How did you get into naturopathic medicine, and how did you start to get involved in laboratory assessment and even went on to write this book on case studies?
Okay, that's a good question. So the thumbnail sketch of that. Well, I knew I wanted to go on to go to medical school, and it was really the decision between an MD or an ND. I grew up in a pretty holistic family, actually with a really, really progressive mom. So I was aware of, growing organic. And in fact, you couldn't readily access organic when I was a kid. And my mom would have big packages of different grains come in the mail. And, we were taking our brewer's yeast and so forth. And anyway, she was just giving us sardines when I was in 6th grade, which was devastating, but I ate them. So I grew up with that foundation, that kind of body of information sort of instilled in me and from such a young age, and rebelled, had my phase of excessive junk food and really found my way back to it. And it was just, it was kind of an interesting serendipity, I guess, just a number of events that happened. I needed to, after undergrad, I got a part-time job in a health food store, and I was working in the supplements, and it was very interesting for me. And I found Udo Erasmus' work on fatty acids and fatty acid biochemistry. I was stumbling into the world of nutritional biochemistry and just absolutely falling in love with it. And that was how the process of decision-making kind of unfolded for me. And from that, I realized I could dive into this further if I pursued naturopathic medicine. And while in school out in Portland, Oregon, I came upon Jeff Bland and heard him lecture, and it was just inner epiphany after inner epiphany. I was so excited about this and ended up applying for residencies, and I wanted to do a combination residency, and I didn't think that was a possibility. But lo and behold, there was a position at Metametrics Lab that was, steeped in biochemistry and laboratory science under the direction of the great biochemist, nutritional biochemist Richard Lord, along with clinical training as well. And I knew that would be home for me. And I'm so grateful that I got the position. And it's amazing how it worked out, because it was so intellectually and spiritually nourishing for me. I just absolutely loved it. So that's kind of the nutshell of how I discovered my calling and my interests over the course of many years, distilled down into a minute or so.
That's beautiful. Just listening to your personal story there growing up, I feel like we're sisters, kind of coming from households with health nut moms who really eventually changed our lives through their advocacy. So that's really beautiful to hear. And then you've studied with experts and actually working at a clinical laboratory, getting your your feet wet, really in a lot of not just running these labs, but really understanding them at a very deep level and
Mm-hmm.
looking into the validation of these labs. And, and many people ask me the question, Kara, why aren't some of these labs used throughout all of medical practices? So, why aren't medical doctors and standard mainstream care using perhaps some of these very breakthrough labs that you might find at Metametrics and other laboratories? So, what
Right.
are your thoughts on that?
Well, it because nutrition is still being recognized for the essential component to life, health, wellness. I mean, it's still I mean, we're still considered practitioners outside the box when we focus on, evaluating nutrition status or evaluating the impacts of toxins and so on and so forth. I mean, those kind of fundamental evaluations, those investigations for us are still, they're just not mainstream yet. Mainstream is still practicing from a disease model. So after you get disease X, we'll treat you with medication, unfortunately, even though, as you know, there are stacks and stacks of research behind what we're doing. So the tide is changing. I mean, we know our medical model is failing. We're not really able to effectively treat chronic disease. The larger medical model is failing in that arena. And so what we're doing, it will be embraced.
Mhm, mhm. Do you think that's another 10 years? Do you think it's 5 years out, or do you think it's 20 years out? Just out of curiosity, just based on what you've seen being in this field for so long.
Yeah, and I was practicing in a conventional setting for quite a while. Well, I was at a pain clinic, a chronic pain management clinic in New Haven, Connecticut. They had been the Yale Center for Chronic Pain Management. So, well, I mean, it's interesting the fact that they brought me on. They were recognizing this whole other area that was inadequately addressed. So they brought me on board. So that's a step. But, I think it's going to continue to be grassroots. I mean, there's a lot of science out there. I mean, so on one hand, it's grassroots. So you, the consumer, you, the patient, telling your physician this is what you want and this is what's important to you. When you go in and you tell your physician, I'm taking fish oil, I'm taking CoQ10, I mean, you're changing the model. You're forcing the expansion. So the consumer, the patient is empowered in that way, even though sometimes patients feel frustrated and feel like they're not being heard, but they're really ultimately probably expanding the medical field more than anything. So there's that piece. But also the research on vitamin D, for instance, is so copious that is a mainstream assessment now, whereas before it was only, we were the only ones looking at vitamin D levels, and that has been accepted. I think that the idea that gluten plays a role in a lot of these conditions that we see, I mean, I think that's being a little bit more accepted. So slowly things are changing.
Well, on
Yeah.
that note, what about detox? So the
Hmm.
focus of this summit being detox, that seems to be one of those things that is looked at as, is it a myth? Do we really need to detox? And
Right.
I'm going to ask you to start going into some of the labs, but before we do that, just even this whole idea of detoxification, why is it so taboo and not recognized in standard medical practice? I mean, vitamin D and gluten, yeah, we're getting there, and thank
Yeah.
goodness the individual is pushing that forth, but how does the consumer, the patient, know to really push forward on something like detox? Is there something there?
Yeah, absolutely. Gosh, it's the same kind of thing, except I guess it's even, yeah, it's further behind. So this recognition of toxins impacting our health. Boy, every single day there's a new study, right? All the time. So the awareness is growing. I think that mainstream clinicians are a little anxious about it because they don't quite know what to do, but it is an essential component for patients to be thinking about with regard to their health care. And what I would say, so we're going to talk about this at a number of different levels, but if you're going to your conventional doctor for your physical exam, so your primary care physician for your physical exam, I would start to insist that they look at whole blood toxic metals as part of that screening. So you go in and you get that standard battery of labs, like your lipids, your cholesterol and all that. Tell them that you want a blood lead level, a blood mercury level, a blood cadmium level, and a blood arsenic level. And I would do that as part of your annual screening. And you can get that covered by insurance and do that from your mainstream doctor. Just insist that you get that. Now, that's arm one. Arm two is that indeed we do all have a toxic body burden. So, do you need a more sophisticated evaluation? Complex chronic conditions do have a toxic component. So, toxins can cause or contribute to a lot of the diseases that we're seeing today, if not all, actually. So, if you think that you need that further evaluation, and I'd argue that a lot of us really do. If your health is compromised in any way, then it would be wise for you to look for an integrative physician who can do a more sophisticated assessment. But if you're generally healthy, as a part of your annual screening, get those whole blood metals done and take a look.
So, Kara, that's great advice. And I'm just wondering, just to track back to what you're saying about that request for whole blood toxic metals, is that a reliable indicator of heavy metal burden? What will that tell the patient? What will that tell the practitioner?
Right, right. Well, it is and it isn't. I mean, it's really, I would call it a screening tool. And you want to actually ask your practitioner for the results. Have them in your hot little hand, put them in your, possession with the rest of your medical records. And if you go to an integrative doctor, be sure to bring those with you. So whole blood metals will show current exposure. For instance, I saw a 20-year-old the other day, a good thinker. She's on a clean diet. She's really trying to eat as healthy as she can, but I do that whole blood screening on all of my patients. And her mercury came back really, really elevated, as was her arsenic, very high. So clearly, since they're high in the blood, that means something in her life right now has mercury and arsenic in it that she's ingesting, or that she's touching, or, we have to explore and figure out what. In her case, the smoking gun was that she was eating, her and her mom were eating lots and lots of sea bass. Chilean sea bass, which is one of the most mercury toxic fish out there, and that was likely the arsenic source as well. So even though they were savvy consumers, they were not educated with regard to safe fish. And incidentally, as you'll hear on this Detox Summit, I'm sure you'll get this information, but one of the easy resources is the Environmental Working Group. Their website has a list of safe fish. Chilean sea bass is one of the most toxic. So that screening helped us quite a bit to show that in current time in her life, somewhere now, she's being exposed to toxins, and we absolutely have to address those immediately. She came to me with really bad fatigue and brain fog, and unfortunately, those symptoms that she has, this vibrant young woman, they're the symptoms of mercury toxicity.
So, Kara, in this case, what did you do for her? Did you just tell her to stop eating the sea bass, or did you have to address the accumulation of those toxins?
Okay, so that brings us to how we actually look at body burden. That's a really good question, Deanna. So we know that, of course, the first thing we have to do is identify where the exposures are coming from and remove them immediately. And then after that, the next evaluation is to look and see whether or not she has a body burden. So these metals, like lead, for instance, can be stored in the bone. Mercury can be stored in the tissue outside of the blood. So the body, these metals are so toxic to the body that they don't stay in blood. The body gets them out of the blood as soon as possible because they are so toxic. So it will just sequester them into other parts of the body that will be less bad than their impact in the blood. So, but what we can do is a follow-up urine test, giving a compound that will help to pull them out. So I'll have them take a few capsules of something. Usually I use a compound called DMSA that will chelate or pull those metals out so that when I measure it in urine, I'm getting an idea of what's actually going on in the body, what's been stored in the tissue. So whole blood is current exposure, and then a urine test with a chelating agent is body burden. So that's our next step with this young woman. we just identified it. But in addition to that, we also need to support her in removing this mercury. So she's going to stop eating the Chilean, or she's stopped eating the Chilean sea bass. Now we need to support her with the nutrients to help her liver and her gut and her kidneys clear the mercury out. So it's actually a multi-level approach. There's a number of different things we're going to do to take her back, to clear her body, to clean her up.
It sounds very complicated in some ways, and it sounds like you identified the root cause of her toxicity, the fact that she was having this sea bass. But is that sometimes, here's a kind of a play on words here, is it sometimes a fishing trip? You have to kind of figure out how long does it take sometimes to figure out where that toxicity is coming from? Is it always so straightforward? Or, what are some other things that a functional medicine practitioner looks at with regard to exposure? How do they do that hunt?
Yeah, that's another good question. Yeah, there's not always a really obvious smoking gun. It can take a while. So if somebody's coming to me, I am going to start our appointment off. Actually, before they come in and see me, they're going to be filling out a really detailed environmental exposure questionnaire. And I'm also going to be getting a past history questionnaire filled out, where they've lived, what kind of an environment, so I can start to get a sense of, whether or not they've been likely, well, actually, we've all been exposed to toxins. We all have a toxic burden, unfortunately. All of us have toxins in our body. The question is, how bad is it, and how much of a role is it playing in your physical complaints? So that's what I need to answer. So I get a really, really detailed history. And usually, Deanna, it's multiple sources. It's not just the Chilean sea bass, as we saw in this young woman. It's multiple sources, and we piece together. It's like piecing together the puzzle to figure out, well, for instance, I had a patient when I was in my residency in Atlanta who had ALS, which is a motor neuron. It's a disease. It's a neurodegenerative disease, and his history was that he grew up in Florida in the orange groves, breathing in the pesticides, and there's lots of research out associating the two, pesticide exposure and these neurodegenerative conditions. And so for him, getting a good history led us to seeing what happened. And then from there we can consider doing tests. I've talked about heavy metal tests, which are very widely available. There's also a number of what we call organotoxin tests. So pesticides and different kinds of compounds, like the things in plastic, or in cosmetics. I mean, we can evaluate for a number of these things now using labs, and that'll help us. That again will, really give us a sense of what we need to treat, what we need to change in their life.
Excellent. So you mentioned a couple of key things there, just to recap for the listener. So we started out talking about toxic metals, but then we progressed a little bit to talking about pesticides. And then you mentioned personal care products, so things like parabens and phthalates. So there are different body compartments. And what I'm hearing you say is that the body is very wise in how it decides to shuttle these toxins through. So tell us, with respect to labs, what are the body compartments that are being evaluated? And are there different levels of accuracy based on those compartments? So is hair or urine, blood, what would be kind of first and foremost? What's the most premier compartment to be looking at, and what do we find out from that compartment?
Well, we need to take, it's actually a pretty good idea to take, a number of snapshots, if at all possible. So look at a number of different compartments, as you say. So the best recognized for toxic metals is whole blood, but we know that's only going to represent very current exposure. But if we want to look at body burden of toxic metals, then we know urine, and urine with a chelation agent is the gold standard. It's a pretty well researched. There's a decent body of research on that. Now, if we're looking at organotoxins like pesticides and volatile solvents and so forth, those are going to be done if they're a compound that stores in the fat. a fat-soluble organotoxin, like some of the pesticides, if they store in the fat, then we're going to be looking at blood. We used to have to actually take a biopsy of the fat, which was really painful. But we realized that there was a special analytical technique actually looking at the fat in the blood that was as accurate as taking a fat biopsy. So we no longer, thank God, have to do that. So, urine obviously is a way that we eliminate our waste, and a lot of toxins or byproducts of toxins are eliminated in the urine. So that's a great specimen for evaluation. Now, hair analysis, there's lots and lots of good data on hair analysis for arsenic, mercury, and lead, but really not a whole lot beyond that. So I know sometimes hair analysis gets touted. I don't know. It gets a lot of publicity, I think, in certain arenas as being something that, claiming it's more than what it is. We will absorb toxic metals into our hair. And if you take a sample of your hair right at the, kind of at the nape of your neck, right where your hair meets your scalp, that's going to give about a 3-month exposure history. And the most reliable metals are just, as I said, like, arsenic and mercury. And lead, but I think really arsenic and mercury are the best using hair, even fingernails for that matter. When they're looking at arsenic toxicity, arsenic poison, you can actually pick it up in fingernails and toenails.
So are there other, you're a pro when it comes to physical diagnosis. Are there other body indications of toxicity? So without even having to do any specific labs, just looking at a person and saying, wow, we should explore toxicity here. Are there other, just like you mentioned, the fingernails, are there other things?
Sure. Well, you can, certain rashes can be suspect as being caused by toxins. Change to hair, loss of hair, texture changes to hair. There might be subtle changes. Actually, I said we could use nails as a specimen, but you can see changes to the way that the nail grows in toxin exposures quite a bit. You'll get white spots, on many nails, just not just on one. I know you're probably looking at your fingernails now, and if you see one white spot, that's probably because you accidentally banged your nail, your hand hard. But if you see multiple white spots on on your fingers and maybe even on your toes, it's possibly related to toxins. Now, you can't don't determine that in fact you have a toxin exposure and that's the evidence. You need to work with somebody who's familiar with that sign and evaluate, because essential mineral deficiencies like zinc can show up with that same kind of sign. A yellowing of the fingernails. Now, smokers will have a yellowing of their nails because of the nicotine exposure, the tar. But, if you're not and your nails are yellowing, that's another reason to consider looking at them. So changes to skin, changes to hair, changes to nails, rashes and so forth. There are clues that can suggest that you have been exposed to toxins.
That's excellent. So now one of the compartments that you didn't mention is the stool. And I
Yeah.
remember reading that most of mercury, 80% of mercury that's excreted from our body comes out through the stool. And being that a lot of these toxins are fat soluble, that would make good sense rather than the urine. So I'm just wondering, isn't stool looked at as one potential compartment for toxin load?
It is, actually. I have to say that in my practice, I have not used it. I've not used that specimen to evaluate mercury exposure, but I do know that there is at least one lab that offers that method, and they're a good quality lab. And you're correct. We do move a lot of mercury and other toxins out through our bowel movement. So yeah, that could be another reliable specimen. For my background and what I'm comfortable in and what I think is adequate, blood and urine, sometimes hair, are the specimen that I most commonly go for.
Mm-hmm. So, Kara, based on what we're talking about here with the stool, and knowing that many of the heavy metals do make their way out through bowel elimination, if we are constipated, will that change the reabsorption of those toxins back into the system? And should we be looking at gut function?
Absolutely. Absolutely, absolutely. And it's such a great question. Thanks for bringing it up. So, yes, in my practice, before I jump into chelation or some sort of a aggressive approach to removing the body burden of toxins, we have to get all of these foundational ducks in a row, if you will. If now, not just are we going to recirculate toxins in the body if we're constipated, but anything that we eat that has toxins on them, be them pesticides or be them metals, if we're not eliminating, every day, if we're not having a complete BM daily, those toxins are hanging around and they'll be absorbed. That is one of our biggest routes of exposure, what we put into our mouth. So both recirculating and just our baseline exposure. So we absolutely need to be having a complete bowel movement, at least one every single day. And additionally, if we're going to get the body moving out toxins, we want to make sure that we have all the nutrients involved in helping our body to detox. And, being replete in our mineral, like making sure we have enough of our essential minerals, is one of the most fundamental ways that we can protect ourselves from toxins impacting us. And in fact, even from absorbing toxins in the first place, having enough minerals in our body will help to not only detox the toxins, but inhibit the toxins absorption. So yes, good gut health and good overall health is essential. Yep.
So, Kara, what do you mean by that exactly? So, you're saying that if somebody has enough in the way of essential minerals, can you tell us what those minerals are and how do we know if we have enough in the way of essential minerals? What food should we be eating? What tests should we be getting to determine that?
Yeah, good question. All right. First of all, we can assume that most of us are insufficient in some minerals. Like, for instance, only 7% of the population gets enough potassium. About 50% of us actually get enough magnesium. So most minerals we need to consume more of. So a really good example, actually, I have two examples. When we become deficient in iron, the way that we absorb iron in our gut is actually increased. There's little proteins called transport proteins that bring iron from our food, from our gut into circulation, these little transport proteins. When we're iron deficient, we increase the quantity of those transport proteins. And they're actually pretty nonspecific. So can be transported that way, but so can cadmium, so can lead, likely mercury, etc. So if you don't have enough iron, for example, toxins that you've consumed that are in your gut will hitch a ride in to systemic circulation on these transport proteins. And what's amazing is that those very similar transport proteins are actually in our blood-brain barrier. So at that barrier between our bodies and our central nervous system. So our periphery and our central nervous system, that barrier has transport proteins too. And if we're deficient, like in iron, again, those toxins can be taken up into our brain, into our central nervous system. So just being replete in our minerals, making sure we have enough minerals alone will help inhibit absorption, not just into our periphery, but also into our brains and our central nervous system. It's one of our most powerful tools. And so part of my workup for a patient would include looking at the levels of minerals in the body. And I think that the best way to do that is using red blood cells. And you can, again, order these through using your insurance most often. You could actually try asking your primary care doctor if they would be willing to order for example, a red blood cell magnesium or a red blood cell zinc level and so forth, and see if you have enough of it. Now, once these minerals are in our body, of course, magnesium, selenium, zinc, again, they also play roles in getting the toxins out. One of the amazing things about selenium, well, it helps in its role along with glutathione actually move toxins out of the body, but selenium is known to be able to actually bind mercury in the body and render that mercury non-toxic. Pretty incredible stuff. Selenium. It's an essential mineral for protecting ourselves against toxins.
Kara, is there a certain amount of selenium that you think that we should be getting? Because I remember reading, 200 micrograms, and there's a certain sensitivity about it having too much selenium. Is there any truth to that?
Well, selenium is pretty complex, but yeah, you wouldn't want to, I would say 200 micrograms is absolutely safe for regular use. And, you can get Brazil nuts from a lot of selenium in Brazil nuts. You can eat it in your food. There's some yeasts that are high in selenium as well. But yes, you can have too much selenium and it can be a problem. So, I would say for safety's sake, you want to keep it at about 200 micrograms per day, unless you're evaluated by your doctor and your doctor determines that you're low and gives you more selenium, or if you're using it for if your doctor prescribes a higher amount short term to help you with the detox process, then I think that it would be appropriate to go with more selenium.
Great. So, just to take us back to the labs again. So, let's just imagine a patient comes in and they're complaining of brain fog because some of the things that you said there really made me think about the brain and all of the issues that people have with toxicity and then behavior, cognition. And this is one of people's biggest concerns is losing their mental sharpness. So, how would you take a patient through the functional medicine lens and evaluate them for their changes in cognition? What are some of the things? Would you be looking at heavy metals right off the bat, or would you be looking at other parameters? Kind of take us through the landscape of somebody coming in for brain fog. Where would you go, and how would you take them down that path?
Right. That's a great question. So, brain fog is a common complaint. I would say at least 50% or more of my patients complain of just, not having as good a quick a memory or just foggy thinking or mental fatigue, etc. So that's a very, very common complaint in my practice, and I think a lot of our practices. Again, you have to take an extremely careful health history, and I use a pretty long intake form to do that. And I also do the environmental history, as I mentioned to you earlier. So two good intakes, and then we spend a lot of time talking about what their history is when they come to my first office visit, and I do a physical exam. So when people come to me with these more vague complaints like that, I'm going to probably cast a relatively wide net, I like to say, with my laboratory evaluations because brain fog can have so many causes. So, is it a mineral deficiency causing it? Is it a toxin exposure? Is it numerous toxin exposures? Is it a thyroid issue? Is it a hormone issue? Is there food sensitivities? So, I'm going to be looking down a number of different avenues in my process of sleuthing. And of course, having a good history from the patient will help me narrow down where I need to do the strongest investigations, laboratory investigations. But yes, Deanna, toxins are without question going to be high up on my list of things to test for. Without question, yeah.
Okay. All right. So thanks for walking us through that.
Can I give
Please.
you I want to give
Yeah.
you just a quick case. So I have a patient who definitely has brain fog along with chronic fatigue. He actually has a handful of those kind of vague but really debilitating symptoms that can be hard to nail down. So he had started to develop these symptoms after having a viral infection some years ago. And so many doctors over the course, he's had this condition now for well over a decade, and many doctors in the evaluation of him treated him for infections, for viral infections and even bacterial infections that they thought were contributing. But when I took a really careful history of him, Deanna, one of the things that stuck out was the fact that he grew up on a Superfund river. I mean,
Uh,
he grew up on a toxic river literally in his backyard.
mm,
And as I, queried him about his previous experiences, he hadn't got a thorough toxins evaluation, both organotoxins with him, so the various pesticides and so forth, nor had he had, the volatile solvents or the parabens and phthalates, and he had metal toxic metal evaluations, but nobody had gone down this other direction with him. And I thought it was absolutely essential not only to look at whether the toxins were still in his body, but to see what kind of havoc they had wreaked, what kind of problems. And, the mitochondria, the energy center of the cells that we need so essentially for normal thinking and for normal energy, were damaged in him. And I do think that has to do with this history of exposures, of where he was when he was a kid, where he grew up. Also, interestingly, he was in his current life, he's in the medical field, and he uses that hand sanitizer quite a bit. The gel hand sanitizers that so many of us carry around that happen to have a compound called triclosan, which we now know is toxic for a number of reasons, and we don't want to be exposed to it. And he was cleaning his hands with that many, many times a day. And one of his interesting lab findings of all of the different, imbalances we identified on him, he had the highest triclosan in his urine that I have ever seen, just from using the hand sanitizer.
Oh my goodness.
So I know. So for him, I think that even though the viral infection started his descent into chronic fatigue and brain fog and so forth, I think that he was predisposed to developing, to having that kind of a response to a viral infection from his history of toxin exposures. And it was further impacted by his current exposures to toxins. Does that make sense?
It makes absolute good sense. And I'm just wondering here, just being the listener and wondering what everybody else is thinking about this very intriguing case. How long can these toxins have impact? Because that's something from his childhood. And here he is an adult many, many years later. And there's kind of this cascade of different events that kind of led to him having these symptoms. So, is it easy to get rid of these things? Or, don't they kind of process through us? Don't we isn't that why we've got a liver and a gut and skin and lymph and all of these different organs to push through these toxins? I mean, isn't that what our bodies are meant to do? Or, can these toxins really have long-term effects that impact us for our lifetime?
Well, Deanna, I wish that our bodies could say, "Hey, this is a toxin. It's out now." I mean, wouldn't that be heavenly? And I think that still one of the reasons why it's not yet fully embraced by the greater medical community is because we have this idea that our body can handle all of these things. Now, the fact of the matter is, we evolved with a very sophisticated system of being able to detox, and it's primarily in the liver, but it's really total body. We have total body detox systems, but the liver is the probably the main place where we do it. And so we absolutely evolved with the ability to detox, but detox from compounds, like that we evolved with. So for instance, we've always had lead, we've always had mercury. I mean, those things. So our body has some idea of how to handle those. Although, let me tell you, it's only been since industrialization that we actually have a ton. We have so much more now in our atmosphere of these toxic metals than we evolved with. So we do have these systems of being able to move out some of these toxic metals, but we do overwhelm our systems. But the organotoxins we're talking about, the triclosan, the DDT, the DDE, the phthalates, the parabens, et cetera, these are man-made chemicals. They are man-made. Some of these compounds our body is pretty darn confused about. I mean, they're like trans fatty acids. Trans fats. I mean, they're these man-made chemicals by and large that I think really gunk up our metabolic works significantly. And unfortunately, we don't just have one or two or three of these compounds. We've got thousands and thousands and thousands and thousands of them. A lot of the research on these compounds, and I know you'll be talking about this more in the Detox Summit, it's just done on, how bad does it affect the body if you're only exposed to one compound and a lot of it. But in fact, we're actually exposed to, thousands and thousands and thousands of these compounds. And there's synergistic effects. So unfortunately, it's just, they absolutely do impact our lives in the course of disease. And we have to be aware of them and take precautions around them and help minimize exposure and also help eliminate them from our bodies. Now, I want to say that after hearing me say this, and actually probably hearing other interviews in the Detox Summit, you may become really, really depressed. And I wouldn't blame you because we do live in a toxic world. However, we have a pretty remarkable body. We are able to detox, and integrative medicine is putting its arms around how to optimize it. So there are things that we can do to take care of ourselves. And I think that that's really important to know, that we can address these and that we're always continuing to learn how to address them. Some of the fat soluble toxins like PCBs, polychlorinated biphenyls, PCBs, they store in the fat and they're really, really hard to get rid of. Our body just doesn't know what to do with them. And we know that they have, lives in our, they stick around the body for decades and, a long, long time. And I'm aware of a case, actually, I was involved in a case where we get exposed to these guys eating farm-raised salmon. That's one of the most common exposure source, or non-organic butters. So we get exposed to these PCBs, and you can measure PCBs. So I was involved in a case where this individual was eating a lot of farm-raised salmon, and his baseline PCB assessment was high. He had a bunch of PCBs. Now, if you look in just the research, you think, oh, I'm stuck with these PCBs. They're in the fat. They're not going anywhere. Our body doesn't really know how to eliminate them very well. It's actually pretty discouraging. And many of us have these PCBs in our body, and there's a whole host of different PCB types. So his baseline labs were high in PCBs. Okay, first remove the exposure source. First, stop eating the farm-raised salmon and anything else. Don't ever use inorganic butter, if at all possible. Or inorganic dairy and so forth. First thing, remove that exposure source. But then we did a detox with him, a pretty standard detox with, a powder that has lots of nutrients to help move things out, some extra sweating, some extra vitamins and so forth. I did that for a month and retested his PCBs, and they were noticeably lower. And I was so thrilled with that. And I'll tell you, Deanna, the more that we do this work, the more data are going to come out around, yes, in fact, there are things we can do to protect ourselves. More solid data will come out around this. There's a group out of Kentucky, the University of Kentucky, who's showing that in animal models. For instance, this group is showing omega-3 fatty acids, so fatty acids from fish, or a high fruit and vegetable diet and so forth, can actually protect one from the effects of PCBs and other organotoxins. There are things that we can do. And I want to kind of wrap up on a positive note. I do want to say that we have skills, and our skills are ever growing.
Well, you were reading my mind, because you're absolutely right. When we hear this information, it almost becomes, we could throw up our arms and say, well, gosh, what do we do? We're just bombarded. Or we can take this information and empower ourselves to find a functional medicine practitioner to work with, to get the labs, to understand our symptoms, to get to know what we need to do. So Kara, this has been incredible. This is just information dense with so many great pearls. How do we want to just now close with 3 takeaways? Like, if there's just 3 things that you want people to remember from this interview, what would they be? Just in quick sound bites, just 3 things.
Okay. Well, you definitely have been exposed to toxins and they're in your body. But we can evaluate for those toxins and find out what's going on with you, and we can work to remove them and limit your exposure to them in your future so that they don't impact you or they move on you in your life.
That's great. All right. Well, thank you so much, Kara. This has been phenomenal. Really great information. And you can just tell your level of wisdom in this area by all of the different cases, the people that you've seen. And for those of you who would like to know Dr. Fitgerald's website, it's www.drkarafitzgerald.com, and it's Dr. Kara Fitzgerald. And again, she's an incredibly brilliant, knowledgeable functional medicine practitioner, and really an honor to have you on the Detox Summit, Kara. Thanks for being here.
Thank you. My pleasure.